right. Well, welcome everyone. Of course, I'm always excited to be here and I love hearing stories. And we are going to keep in mind that, respecting everyone's opinion, be courteous of time when you have questions or want to give input. And we're going to go ahead and get started so that we can hear Claris's story. And we have, Claris, do you have a presentation to share or?
Yeah, I've got a PowerPoint just to guide me.
Okay.
Just to make my talk a little bit structured. Otherwise,
I totally understand.
I
We'll let you go ahead and share that. And if everybody can remember, just to keep ourselves on mute, I know that I have to do that for myself because I make a lot of verbal statements out loud. All right, we're just waiting for the share. You should have permission.
Let me see. Lesra loves music, so he's got his music in the background. So
Zoom is really good at filtering. I do not hear it at all.
Okay.
Yeah. Zoom is good at filtering background. And we are here. This is a no masking zone, so he can listen to his music just fine. There we go.
Is it? Okay. Do you want to come, Les?
There we go.
Yeah.
All right.
Let me get Lesra. So
go ahead. Go ahead. If anyone has, I can see the screen, so I think we are good. And change my view so that I can make sure.
Okay, sit down first, and then we talk. And then you go. Is that okay? Is that okay? Well done. So
all right. So Claris, are you ready?
Yeah.
All right. Well, we have Claris here, and I'm a first name person, so I do apologize since I know Claris, and she is going to tell us the story of her journey of parenting to becoming an SLP. So go forth and share, Claris. We are ready to hear your story.
Okay, so thank you everyone for having me here today. I'm Claris Angafor, and this is Lesra Angafor. He's my son. He's going to be 20 in October. So Lesra was born at 24 weeks plus 5 days, so he was barely under a pound when he was born. He stayed in the NICU for about 3.5 months. Can everyone hear? Okay.
Your audio is good.
Yeah. So he stayed in the NICU for about 3.5 months or 4 months or so. And while he's been growing up, because obviously some children, when they're extremely premature, he had a brain hemorrhage. So as he's growing up, he was diagnosed with autism, was diagnosed with mild cerebral palsy, and then he's growing up now with it's nonverbal. So he also has mild cerebral palsy. I think I've already said that. And he's nonverbal at the moment. I haven't yet given up. So, however, he communicates. Yeah. Does he want to go now and reduce your volume? Yeah, go put it down. Okay, go there, go and reduce your volume. Bye. Okay. So, just getting started. Right. So I'm Claris Angafor, and I'm the founder of a charity, UK-based charity named Canabilities Foundation. I'm also an author of a book called Grief to Grief, which I wrote in 2020 as a result of the loss of a little baby. So I was hit very hard with the emotions that come with the loss of the baby, and I was inspired to write the book. But in this book as well, I also had to mention a few things about grieving a child with a disability. So, and today I'm a speech and language therapist, and I work in a secondary school. And becoming a speech and language therapist was more the main reason, or my main motivation was Lesra. We call him Prof Les based on our post on Facebook. So we just call him Prof Les, and people have geared towards that to start calling him Prof Les. And I truly believe that every child deserves to be heard even when they don't speak. So that what I do for a living at the moment, I'm a speech and language therapist. I support secondary school children. Most of them are autistic, most of them have ADHD, and most of them have social, emotional, and mental health. So I provide the support that they need. So I provide specialist speech and language therapy services to these children. I'm also involved in assessment, report writing, and also formulation of appropriate interventions. So if a new student comes into my service or into school and they have the provision for speech and language therapy, so they're sent to our service. So because they're new, we usually do an initial assessment. We assess them to see how we can best support them as far as their speech, language, and communication needs, or social, emotional, and mental health needs are concerned. So while doing this, I'm also actively involved with parents, with teachers, with SENCOs, with learning support assistants, because it's difficult to support the child without the other people that are supporting them as well. And I also work hand in hand with occupational therapy. So each child, or most of the children that I see, they also are being seen by the occupational therapy. So we usually work together. Sometimes we do joint sessions with them. So how I got into this field, like I said, it was solely because of Lesra. While he was still growing up, while we discovered that he had that he was autistic and he needed support. And obviously at around 2, when you're a parent, you start noticing the differences. And there were instances where we've sent our child to school and they stopped us at the door. They had to ask us to take him back because we cannot cope with him. He doesn't sit in one place, he climbs places, he throws liquids, he doesn't have awareness of danger. So they told us he's basically everywhere. Then he was 2.5, he had not had any diagnosis. And then obviously those first words that you are expecting were not there. The only word he's ever said in his life is mom. And that was when we went for one of his consultant appointments, and he said mom, but he was standing and facing his pediatrician. So my journey has been led by raising Lesra, has been led by also love and also the purpose. And alongside raising him, I've worked within the NHS in different roles. Just before I went into becoming a speech and language therapist, I was actually working as a data quality analyst. And then when I knew that Lesra was autistic, I wanted to know more about autism. So, right, wait, I'll come and see you in a minute. Wait. Okay. Yeah, sit down and wait. So I wanted to know more about autism because before I came to the UK in 2024, I'd never heard of the word autism until a friend said to me that she works with individuals with autism. So to me, when I heard the word autism, I thought it had something to do auditory or autism. So, and then a couple of years later, I had a child and he was diagnosed with autism. Don't get your cup and put it inside. Don't put it in your cup. So a couple of years later, I had a child who was diagnosed with autism, and living in a community or growing up in a community where where there's still that stigma, that taboo around disability. There's still the taboo around people who have a disability, or even parents of parents of children who have a disability. So you feel stigmatized, you feel isolated. At one point, I felt people thought if my child touches them, or if my child touches their child, drink water, drink water. So it felt like if my child touches their child, they will also be infected with whatever he had. So going out in the community became very, very difficult. And even me being involved in other community activities was very, very difficult because people plan events, people have events. Hold on, let's see. So people have events for their children and they don't invite my child. And I started initially by raising awareness because I was also grieving. However, then I never knew I was grieving. So, and I used to be very defensive, very reactive to what people would say, to the looks that you give to my child, to the whispers behind my back. But at some point in 2015, I had done a lot of reflection, and I said to myself, I am not going to be reactive anymore. Anyone who says anything negative about my child, I am going to see it as a learning curve. So, and I'm going to see that person as ignorant, that the person needs some form of education. So that's how the journey turned. That's how my grief kind of turned from maybe denial, anger. Please, hold on. Let's see. Just bear with me, please. Where's the water? Can I just excuse myself for about 1 minute, please?
This is life parenting. It is what it is. So what I'm not really sure if we'll get a chance, but please put your questions in the chat if you have any. I know that she is just getting into the story. I don't know if a lot of folks are aware, for those who are not in Africa, I think that we have to remember that every country doesn't have a lot of speech therapists or even a training program. So I think it's exciting that she is an SLP, and I need to ask if she's living in the UK now or not. I can't remember. Is that saying hello? Are you saying hi?
Say hi every time a new person joins. So
I love it.
as he should.
The official welcomer, greeter, hello. I'm in Mexico, and there was some work that was done on the house, and they came in with an adult son who was autistic, and he wasn't using words. And so I was asking his mom, how does he communicate? And I asked her if she had been introduced to any kind of tech support for communication. And she said, no, no one had introduced it. And so I pulled out my iPad and I asked him a question, and he answered it he could actually type text. And so I was like, oh my gosh, we need to get something. But I asked him, I think he's 20, and I said, do you want to learn how to use a device so you can talk to the girls? And his face lit up, and his mom was like, what do you mean? I'm like, he's a 20-year-old young man. I'm sure he wants to do whatever 20-year-old young men do. So, I mean, that's the motivation, right? It's not talking to your parents when you're 20. Who wants to do that? I'm just saying.
To do
That, yes.
Agreed. In that case, let me say hello to what a love.
Is your name?
Sure is.
Oh, I love the way it's spelled. I do love the way it's spelled.
How are you?
I'm good. I am loving the fact that it is Thursday and tomorrow's Friday. It's been a very, very busy week. Love, love, love what I do, but I'm tired by Friday. That makes any sense. All right, so I always have stories to tell. You guys want me to tell another story? Or you guys can share out, like if you guys have something to say. I think that this is just life, and we want to hear her story. And there she is. All right. Is he good?
Yes, he was hungry and he wanted to drink. So,
well, we were taking you away from him, so I can understand. But we're glad that you're back, and I'm going to go ahead and mute myself and let you continue sharing.
Okay, so I was talking about my journey, how my journey started with awareness, with raising awareness about autism, encouraging love, understanding, acceptance for any individual with autism or with any form of a disability, because I acknowledged the fact that there was still a lot of taboo, stigma, shame in my community, where at some point I felt isolated. I felt like the community that's supposed to be supporting me, supposed to be supporting my family and my son, they were the ones isolating us. They were the ones moving themselves away from us. But at some point as well, when I started doing the reflection, going through the grief process and trying to understand everything, I realized that I was becoming quite angry and reactive towards people's reactions, people's behaviors, the looks, the whispers, the little signs, the facial expressions or the body languages that you see from people. But I had to turn it around at around 2015 to say, anybody who looks at my child in a funny way, anybody who tries to isolate my child or says anything negative about autism or about disability, the person is ignorant and needs to learn something. So that's when I started teaching people, I started raising awareness. But the straw on the camel's back was when one of our friend's daughters, we went for a party. So then I think then she was about 10 years. So two 10-year-olds, they were talking, and then Les ran into the room. The other one asked her, what's wrong with that boy? So she said, he is. And that was it. So she just used her finger like that. I think most of us may know the meaning of that sign. And then I was angry. I was angry with I wasn't angry with the child, but I was angry with the child's parents. Because I thought that they would have told their children about, given that they were our friends, our close friends, and they've known my son since from birth. But I also realized at some point that if you do not tell people what is happening with you or with your child, people will not automatically understand, people will not automatically know. So I learned now how to, for those who wanted to know, I mean, in a positive way, I learned now to also explain to them rather than just saying he was born premature and I expect everyone to know the rest of the things. So I also learned to tell them, to explain that, okay, he's got autism, this is what autism is, and this is how it affects him. So if you see him flapping, jumping around, behaving this way, or if you see him running from one end of the room to another, he's not going to hurt anyone. He may hurt someone, but not intentionally, because maybe his focus is where he's going to, and he will not see a little child on his way or anybody on his way. So when I started that awareness journey and I started educating, and how I started with children, because I looked in the future and I said, if we knew what autism was at an early age, we wouldn't be behaving the way adults are behaving now. So I decided each occasion or each event I went to, I would request, please, can I have 3 minutes to talk? Can I just say something? It was very difficult at the beginning because people were like, well, you want to talk about autism. There's a lot of information online, people can go and read. So what do you have to stand here and talk about? But I insisted. And then I also realized how difficult it was. I decided to create my own platform. I went on Facebook, I went on social media, and I started talking. Mostly my main reason, or my motto, it still stands today, is to encourage love, understanding, acceptance, and inclusion of anyone who has any form of disability. So autism. So then through me, through my son, and through my family, many people many people know about autism. They have an idea about what autism is, and they've gone further to learn, or they've gone further to start raising their own awareness. Then when I lost the child, I was going through the grief period, because I also learned that when you're going through a difficult moment, you can also look into that difficult challenge and see what you can gain from it when you are coming out. Can you have a positive story to say while you were in your difficult moment? So then I enrolled at the Sheffield Hallam University. It was a one year course on autism and Asperger. So I completed with a postgraduate in autism and Asperger. Then I was given the opportunity to do 2 more modules to have an MSc or an MA, a master's in autism. But I was still thinking, and I was also looking at my son, what is it that I can do to support not only him, but to support other people, to support other families or other moms who are like me, to support other children who are like my son. So I declined that offer, and I came back and I looked at my son again and our journey. What is that area that has been most prominent? What is that? Speech and language therapy kept coming up. It was, I couldn't ignore it. So I decided now to try and look for admission in universities in the UK. So that's how I started. So, and along this journey, I realized, and going into speech and language therapy was because when people hear he's not talking, and then they are surprised. He's not talking, but he can do so many things. He's not talking, but he hears, he understands. When you give him instructions, he understands. So, and I've always said that a child may not talk, but he can understand and he can follow the instructions that you give him. And going into this course as well, because I was taught this phrase that communication is not only about speech, because there are other forms of communication. There's non-verbal communication, which Lesra tends to do a lot of it. Sometimes you have to have so many eyes to see the subtle signs, the subtle body language, because he can come to you and he's maybe tapping his bottom. He wants to go to the toilet, but if you're not vigilant, you will not know that he has said something to you, and then suddenly an accident occurs. Meanwhile, he had already communicated. So it was out of the love, was out of the passion, was out of raising him that I went into this field. And some point within my journey as well, I'd also supported individuals with young adults with learning disability as well. And one young lad stood out for me because I was supporting him, and I realized in his drawer that he had pecs, but nobody had never used them, because my son started with pecs. But this young lad, he was just there. He will pull you, he will push you, he will even hit you. And I also realized that many people didn't understand all this. He will even hit his face on the wall when he's trying to communicate. So I used to tell them, he is saying something. He's not just misbehaving, but he's saying something. And if he's hitting his head or he's trying to hit you, do not run away and lock him inside and stand outside. Instead, try to understand what he's saying. So I worked with him and the manager. Then we initiated, we encouraged him now to start using the pecs, even though he was still at the initial stage. But there was some form of he was communicating, even though it wasn't in a way that we'll be able to understand. But he started using the pecs, and yeah. So and one of the things I've also understood as well with autism and communication, that it affects people. It affects people differently, and many individuals with autism will communicate differently, because I've heard people say he's autistic or she's autistic, and someone will say, but he's talking, how come he is autistic, or how come she is autistic? And that realization also pushed me into going in to study more about speech and language therapies. And I remember when I mentioned about hearing the word for the first time in 2005, autism, I thought it was an auditory problem. So when I was growing up, I used to think, I think my mom or my parents used to say, if you can hear, then you can talk. So with my son, I was questioning, I always had this question, but how come he can hear, he can understand, and he cannot talk, he cannot communicate verbally? So there must be something more inside that's not that's not okay. So some of these my questions as well also pushed me into trying to know more, trying to understand more. And also while trying to understand more was not only because I wanted to support my child, but also to be able to support those who have been in the same journey as myself. So apart from just supporting autistic individuals, I also support moms or parents, because those who have a new diagnosis or those who are aware that their child has an issue, I don't want to say a problem, or that a child has a difficulty and they don't want to say anything about it. They are afraid of judgment. They are afraid of what people will say. And many a times people have referred someone to me, please, I don't want you to do anything, but I just need you to talk to this lady. She just needs someone to feel like she's not alone in this situation. And I get it. I do believe that sometimes you don't need to solve somebody's problem. You don't need to solve anything, but just telling that person, I am here. Yes, I have been there, maybe at the age at which your child is, but I'm still in the journey. It's over so many years now. Where I am now, being able to accept, being able to understand, it's not where I was years ago. And sometimes just that communication with other families, it's proven very effective, and it's really helped people a lot. So it was finally in 2022 that I finally made that decision, because I got up one morning and I said to my husband, because then he was studying his PhD, and I asked him, when are you going to finish your PhD, because I need to go back to school. And guess what? In the past, because that was going to be my second master's. In the past, when I used to say, okay, I want to go back to school to do this, there'll be lots of questions. Have you thought about it? Do you want, is that really what you want to do? So that day I stood there, he was sitting at the dining table, and I said, when are you finishing your PhD? Because I think I need to go back to school. He said, okay, you want to go back to school? Yes. What do you want to study? I said, I'm going into speech and language therapy. Guess what? He never argued. He never asked any questions. That was first of his kind. He said, go ahead. I said, but you've not finished your program, so there's going to be a struggle with supporting the boys. He said, I work from home. Go ahead and look for the university, apply, give you the support. In fact, I'm really emotional right now, but so it's more like it was a calling that there was no way anyone would say, no, that's not the best thing for you. And then my boy, Lestra's younger brother, he's taught us. So at some point in 2000, and I think he was 9, he came to me and he said, Mom, when are you going to do that course to help me? When are you going to go back to school and do that course to help me speak better? So these are other factors that actually pushed me into doing this program, and also being able to make a difference in somebody's lives, and also see it. It may not take a day for that difference to show, but over time you may see that difference. When I compare with my job being a data quality analyst, yes, I was making a difference with to patients' lives, but usually it was behind the scenes, was in the behind the computer. So many people will not know that this error that was made on the system has been corrected by someone. But actually now I'm sitting in front of students. I take them to our sessions, and we talk. I may not be able to see those changes now, but I know that making a difference in somebody's life was also another factor that pushed me in it. Then if I have to look at why this field really matters to me, because it helps individuals to be able to communicate better. It helps us to be able to understand, most especially that if someone cannot communicate the way we expect them to communicate, we should also respect the way they communicate, and we also learn to understand their own ways of communication. And then we should also be able to provide, to supply, or to support them with the devices that they may need as well to be able to communicate. Another one which I am also learning as well is the emotional expression. To be honest, since 1 year that I've been working, I've learned how to express myself. I've learned how to express my emotions, because we teach students how to identify, how to label and express their emotions. And I've also learned that. And also there's a family support that you give. When you're supporting your child, you are also indirectly or directly supporting the family as well. Then I love the field, or it matters because there is that flexibility in which area you want to work. So today you can decide to work as a pediatric speech and language therapist. Tomorrow you can decide to work as an adult speech and language therapist. It depends on which area you feel very comfortable. But towards the end of my course, I had conflict of interest. When I started, I was always, I work with children with autism, but my last placement was in a neurological center where I was supporting patients with stroke, patients with TBI, and patients with dementia, Parkinson's. And I so much enjoyed that where I was working. It was difficult, it was very challenging, but because I was working in a unit where I'd worked before as a healthcare assistant, where I'd worked before as a discharge coordinator. So many things were related, but in a different capacity. So now this patient I used to see on the ward, maybe walking with a gait, maybe because of Parkinson's, not being able to talk, or because of stroke, I could understand it now in a different capacity. So but I had to speak with my tutor. I asked her, when somebody graduates, can they work in both areas, pediatrics or adult? She laughed. She said she's working with children now, but she was an adult speech and language therapist, but she did her PhD with children. So, and also what this field also matters because you can work in a school, you can work in a hospital, in a community, or you can also have your private practice, and you can equally work with individuals, maybe in adolescents who are in prison. I think there's a research that states that most adolescents or young adults in prison have some communication issues or social, emotional, and mental health, and some of them do require our services. And then the support that you give to someone, especially that aids in their recovery. You know, last year, I'm originally from Cameroon. Last year, I had to, my last part of my placement, I chose to do it back home. So I worked in one of the hospitals in Cameroon as a speech and language therapist. And Cameroon is one of those countries that is struggling because we do not have the services. There may be, but they'll be very small, or they may not have trained as much as we've trained here. So I had to give a talk to medical doctors on dysphagia, on how they can support individuals with dysphagia. I had patients who have had a stroke. Yes, they have the occupational therapist, they have the physiotherapist to see them. I asked the question, where is the speech and language therapist? So how do you support those whose speech, whose language, communication have been affected? How do you support them? And there wasn't. So I worked there for 1 month, and the amazing thing was the amount of children in the community who have so many different forms of disabilities, and they've gone, they are not diagnosed. So parents don't even know what's happening with them. They do not even have the support. Some of them, I used to go and I used to hide somewhere and I wipe my tears, because you go to see a child, they're sitting, they're just on the floor. And it was heartbreaking. And at times I wonder, where do I start? And then a grandmom would bring me her 12-year-old. He's deaf and he doesn't talk. And grandma wants me to do something for her grandson to be able to talk. So it's not only, it wasn't only about supporting these children or the individuals, it's also supporting the grandparents, the caregivers, and every other person, and being able to raise that awareness on our services, or raise awareness on the different types of disabilities that can affect communication, that can affect language and other aspects of human being. So it was so heartbreaking. So maybe after this session, if there are some volunteers, they can go to Cameroon and help us. So yeah, so it was an eye opener. Yeah, and if I may say, raising Lesra has been, I don't know, I've never known how I was supposed to be or how I could have been if I didn't have a child with special needs. Maybe sometimes I used to joke and I say maybe I would have been a very rich and arrogant woman. So somewhere, but I can't say that for sure, because obviously when you have a child with special needs or with a disability, it's about 2 times or 3 times the time that you require, even to support your other children. It's a sacrifice that you make even for your own self. There were times where you just needed to ask me, how are you, Claris? And I would be in tears, because there was that burnout, there was that stress, there was that hidden depression that I never knew was lurking there. So raising him I've learned that humility, I've learned that unconditional love, most especially I've learned patience, where I know I can say one thing to a child and say it several times before it's been done. Like some of us, as we were raised in Africa, how dare you stand there and your mom says something to you or your dad one time, and then you are not off to do it immediately. Yeah, but raising a child with additional needs, so you learn that probably you've given them that instruction. They need time to process the information. So you exercise patience now to make sure they've understood and that they are going to do it in their own time when they've finished when they finish processing that information. Another thing which I've learned as well is it's never too late for anyone, whether you are the parent of a child with a disability and you want to pursue pursue a journey or to pursue your career. It's never too late. And also, whether you are 40 or 50, I mean, I am 48 now, and I went back to uni when I was 46. So in 1 year, 9 months, I'm going to be 50. And and I've just graduated with an MS in speech and language therapy. So I'm a mature student. Then I used to sit sometimes and I say, oh, most of my classmates, they're medical doctors, they are these. Probably my journey raising my child delayed me. That is a fact, because when you're raising a child, there are times where even if you want to study, you may not be mentally stable to further your education. You may not have that childcare to further your education or to get the career that you really wish. Even if you wanted a particular career, your childcare demands may not permit you. For example, now where I look for a job also is limited, but at least I have a job which I'm kind of fulfilled in it as well. Way back in 2010, 10, 12, 15, one of my friends once said to me, Claris, it seems when it comes to your child, you can just drop everything and go. I said yes. She was like, wow, many women here or many people here value their jobs a lot and they really want that money. That's one of the reasons we had to leave Africa to come here. So I said yes. Many of us left Africa to come here to be able to work, to be able to raise that money, to better our lives. But the thing is, I am not God. And I cannot sit today and I say, I'm going to have another child and I have that child. Even if I have one, he or she will not replace the one that I have at hand. And but I can sit today and I say I'll have a job tomorrow, and I search, I'll have that job tomorrow. So I always said to myself, even at 50, I'll be able to do those number of hours that you guys are doing now, and I'll be able to raise that money that you guys are raising now. But for now, let me take care of my child, because if something happens to him, I will never forgive myself. And yeah, I may not be completely there now, but at least that statement of even at 50, I'll be able to do the dream job, I'll be able to put in those number of hours. Another thing which I've learned as well is you should never underestimate the wisdom of lived experience. That's one thing which many people minimize. There were times someone would say to me, "Oh, I thought you had like a degree in autism because you talk so much about autism. I thought you were one of the professionals." I once said to another person, "I'm a professional by experience because I'm raising a child with autism." When I went into my course, I realized that there was a lot that I knew. So I literally moved from practicals to theory instead of moving from theory to practicals. So it's, yeah, so it was an eye opener. There were things that I thought I didn't know, but I knew them. It was just being able to know the exact word, what was that terminology I could give to this thing I've been doing with my son. And we all know that your destiny may be delayed, but it can never be denied, and that there is always more to communication than just speech. And also, every journey begins with a single step. And all we have to do, if here we are watching, we are the parent of a child with a disability, or parent of a child with any form of condition, that journey begins with a step. It may just have to begin with you talking to another parent, asking, how did you get here? Because all of us who have been able to talk out in public, share our experiences in public, that's not where we were before, because we would have gone through those stages of grief. It's denial, it is anger, it's bargaining, where you sit and you're like, oh God, if he can just say one word, I will praise you for the rest of my life. If he can just, yeah. So we've gone through depression, anger, and acceptance. Obviously, they say grief is not linear. There are every stage of his life. Sometimes I still go back. You still regress because every stage is different. Now he's in college. He just started college last week, and it's been a journey. I've been worried as well. He's been in one school for 17 years. So this is his second school, the whole of his life. So I was wondering, is he going to cope? Is he going to be okay? Is he going? And the funniest thing is that the guy disproved all of us. We went into school and he bounced into classroom, sat, looked at the table where his name was. He sat there and he was communicating with the teachers, tapping his hand, saying please, doodling on papers, and then doing turn taking. I'm like, you don't do this at home. And then you could actually see that at some point he felt where he was. He felt like he was already a big boy, like a big lad in that amongst children. And truly, he's very huge for his age. So you could actually tell, even though he cannot say it, but you could tell that maybe he was already feeling that I'm one of the oldest in this school, and so I need to be in big boys school as well. So I don't know if I've said everything about what I was supposed to say, but this is basically my journey, and I couldn't have been here if I didn't have lecturer. I'm not sure I would have known anything about speech and language therapies if I didn't have the support that I have with family, and then the support that came along when people became aware, and then the support that I also had to give myself, that I also had to learn self-love, I had to learn self-care, and I also had to think about the oxygen in the plane, because I can't lie to you. Yeah. There were those moments of because you are just going and going and going, and then until I almost had a breakdown before it hit me hard, and I started learning self-care. I started learning that if I take care of myself, I'll also be in a better place to take care of others. I also had to look into my own biases as well. Maybe this person is saying this not because of not because they want to insult my child, or maybe because they want to be mean. It's ignorance. It's because they do not know what they are saying, and they want to know more. So when I went through this circle, reflection, going through the grief process, and then I'm kind of now in the middle where I can now support individual. I can now say, at least I'm in a place where I can talk and tell you it's going to be better. It may never be different, but it will be better. As the years go by, you will not be where you were yesterday, and where Prof. Les is today. He wasn't there yesterday. And when he was born, we were told he will never walk, he will never see, he will never hear. And that's the guy. He's never had a single surgery in his life, despite the fact that he was weighing just 980 grams. So I can only say it's been a journey of miracles, of achievements, and being grateful and being thankful to everyone that has supported him, the community, and our online community as well. And seeing Stacy here, thank you.
I just want to say that I know that folks have commented, your story is so inspiring. I think what I heard, because, I work with parents as well. That's how we kind of fell into the circle. But I love that you kept saying it's a journey, because I think parents need to understand that it is a journey. I mean, parenting itself is a chaotic journey. Like anyone who has children, it's just a chaotic journey. But it is different when you're parenting a child who has a disability or has extra supports that are needed, maybe than everybody gave you at the baby shower. So I love that you are, I think what I love the most about your story is you started in your little space, you grew, and then you grew and you helped others, and you continue to help others. And that's the only way we can make an impact, is for everybody to get a little nudge here, a little nudge there, and that you're able to support other families is beautiful. And I love that you're an SLP. I mean, we need more SLPs. We need more SLPs. I don't know if I had the same experience, but I remember working in the public schools, and we would have like the IEP meetings, and there's the physio and there's the OT, and all the parents said was, I just want to know what my child needs. I just want to communicate with my child. Like, yes, walking is great. Yes, feeding themselves is great, but I really want to know, because communication is connection. So if you can't communicate, then you feel like you're not connected to your child. And I think it's beautiful that you are doing this. And I will stop talking and leave space for anyone else to comment or ask questions.
Yeah, I'll just add, being an SLP as well has its own challenges. As you may know, within the 1 year, I've also had my own little challenge. I mean, the recent one I had was, it's a new student at my school, and the parent has requested a new therapist because the child is not building a relationship, one encounter, and I respectfully accepted. So some of my colleagues were like, oh, you need to give another chance. I said, sorry, no, I don't think we were told that you have to ask, please, can you give me another chance? No, because I actually said I am a parent, and maybe I've been feisty as well as a parent, and maybe I've had doubts about the speech and language therapist in the past. And the last thing I want to do is to force myself into a child's life who will not be comfortable during therapy, because she won't be comfortable and I won't be comfortable. And at the end of the day, she will not receive the support that she needs. And then obviously, these are things that many people will not really want to say. And sometimes you see it maybe by body language, facial expressions. And one of the difficulties that a Black speech and language therapist will face is some white children will not want to be. They may not say it, but if you are keen enough, you will see.
Yeah.
yeah,
Yeah.
you will see. And because some of these things you cannot really prove them, you just let them slide. But I experienced that as well, where I was setting up my workstation with my student, my hand touched her and she wiped it on her cardigan. I felt like crying when I came back home, but I said to myself, well, you knew about this and you went into it.
Yeah.
So
Yes.
yeah.
Has something to say. What you got?
Oh my goodness, I have so much to say.
I know. We need to have like coffee, meat, or something.
Yes, one, Claris, I am so inspired by your story. Yeah, I don't even have enough words. I'm an SLP as well and also from Ghana, but I do not have a child with autism. And that, as Stacy said, there are so many challenges just in and of itself. Being an SLP is challenging. Going back to school to get a second degree is challenging. And so the idea that you did all of that as a wife, as a mother, as an SLP is, I don't even have any words. Kudos, 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 honestly, because that's just amazing. I really appreciated the fact that you shared both the challenges and the joys of your journey. Particularly the fact that, yes, you went back to school, but again, being an SLP, oof, this is my 27th year. I'm a professor at the university, doing this work, and all, like, you did such a beautiful job encapsulating all of those. The fact that our profession is not very diverse, and so sometimes, we do have challenges that are often hinged on race that, it's not comfortable for anybody to hear or say, but it's the truth. Even at my level, I'm experiencing things on a weekly basis. And so I really commend you for that, particularly because in our part of the world, in the global south, this is not a profession that is well known, and it again has so many challenges. And so, just the work that you're doing, I honestly can't thank you enough. We absolutely have to keep in touch, because I would absolutely be willing to go to Cameroon. I do a program in Ghana, and I'm happy to collaborate with you offline and speak more about this. Well done.
Thank you. And I think that we have, is it?
Hi. I think you have to unmute. I know, we all get stuck on the unmute. There we go.
There it is. Hello?
Hi.
Hi, how are you?
Glad to have you. What do you have to say?
I'm not sure if I'm showing, but anyway, yeah, so just wanted to say thank you for having this program. It was really good. I am also a speech language pathologist. I am of Nigerian descent. I'm born and raised though. And I work with children in the juvenile education system and then also those in the inner city. So most of the people that I work with look like me. But recently, I traveled to Nigeria for this summer, and I hadn't been back in maybe 10 years or so. And just so happened to be traveling between Lagos and Abuja, the capital. And I heard a child, a little boy, was with his father, and he was crying about being on the plane, about 4 or 5. And then they happened to sit next to me. I noticed that he didn't speak the whole time. And I said, I noticed that. How old is your son? I noticed that he hasn't spoken any words. He said, yes, that's why I'm coming to Abuja because I want to get help for my son. He said he was going to a Reverend Father, and that previously he was waiting for someone to come to his village. He said he said he's waiting for some white people to come to help him. And I said, well, I'm a speech pathologist. I can help. And this is my 18th year of being an SLP. And I gave him my information. He never called. So I thought it was interesting when she spoke about, having something with, maybe a white woman previously she had touched her and she didn't want, she wiped her hand, but I also wanted to, there's also some of that stigma within our own community about, maybe the other people can help us more than our own. So just wanted to give that. And then lastly, a friend of mine who lives in Liberia, she reached out to me about starting some type of way to help people locally in their community to help children and adults who have some communication disorders or difficulties. So I would also like to connect in the future with those and just kind of expand my network. So thank you for having this again.
Thank you so much. I think we can all say colonization did a good psychological job on a lot of people. Lots. And when you were talking, I remember, I mean, I worked for a school in South Louisiana, and you have your caseload, and there was a white family, and they did not want a Black speech therapist. And so the school district shifted everyone around and pulled someone out of their school. And I was like, well, whatever, you're lost because I'm a really good therapist. But that is life. That is life. And yeah, so we have someone else. I think we have time for one more person to get something to say.
Hi everyone. I am from Cameroon, but I live in the United States. Claris, thank you so much for your presentation, and thank you so much for the work you did in Cameroon. I'm getting involved in working with children with disabilities because I have a passion for children. I'm a child mental health therapist but I have nieces and nephews in Cameroon with Down syndrome and autism, and it has been a real struggle getting them services. It breaks my heart every single time I call home, and you just ask a few questions, and it's like you're speaking Spanish. They don't understand that there is something like that that they need. So I am trying to start something up, and I'm on a campaign to create awareness about early intervention for children in Cameroon. So thank you so much, Clarice. I heard you engaging to come and help us in Cameroon. We need you. So that's all I had to say. Good to be here.
Thank you. So now I have to end with a funny story. Well, I think it's funny. I live in Mexico. My Spanish teacher is from Cameroon, and he speaks 6 different languages. And I think it's hysterical that my Spanish teacher in Mexico is from Cameroon. Like, I just love this world. So I hear a lot of Cameroon. I hear Ghana. I've not been to Cameroon yet. Loved Ghana. I mean, I still like ache for Ghana. If I did not have family, I would have never come home. I would have they would have been like, "Where's Stacy?" She went to Ghana and said she was coming back, but she never did. Yeah. So I want to say thank you so much, Clarice, for sharing your journey, for inspiring us, but also I think that you gave so much of yourself, and I think we all are going to take a little piece of that, and we're all feeling like energetic. And I see lots of people in the room, lots of things. I keep saying we just need somebody with a plane to fly us, and we can do the work. Like, I just need somebody to get me there. I don't care where I sleep. I can find food. I mean, that's me, but yeah. We're going to have to figure out how to make it happen. So thank you so much. Clarice, do you have any last final words you'd like to say before we end?
I just want to thank everyone. And well, as you saw, Lesra, that is our life. So that's how we communicate. Many people have asked in the past, how do you communicate with him? And he doesn't talk. I said, but he understands, and we talk, and then he responds in his own way. But if anyone here, if you are here and you're raising a child with a disability, it's not the end of the world. There's still more to you than you can imagine, than you will know. Give yourself time to go through that journey, to go through the process, to go through that grief. Acknowledge, accept that you're going through a process at a particular moment, but aim to, you may never change the situation that you are in at that moment or at the moment, but you can be better. Because it hurts when you stay in one place lamenting, this is not the child I wanted to have. This is not the child I thought I was going to have, without looking at, so what do I do with the one that's standing there in front of me? So let's accept the ones, let's love the ones, and acknowledge the ones that we have in front of us, and we can support them to become a better person, still being the person that they are, because we did not ask God to give us children with needs. So we accept them and we support them with the needs that they have. And it's never too late. if you are thinking of pursuing a career, think of going into school to do that course that you've been thinking of, and then you have a reason, maybe my child, I will not have childcare. Difficulties in starting, but once you start, you will go through because you will have the support. I had support at my uni because there were times I would go to the well-being team, and I will raise my hand up, write an email that I need support. I'm struggling with anxiety and I need support to submit my assignments. I spoke to my doctors. I'm studying at the moment and I need support. So they had to write a letter to my uni so that they'll be able to use that letter to give me additional time. So there will be that support if that's what you're afraid of.
I love it.
Thank
I
you.
love it. That is what I call advocating so that you can be successful. I love that. So we will end here, even though we all want to talk about how we're going to change the world. And thank you all so much for joining us. Thank you all so much. This was really, I thought I had a great morning because my students and I were cracking up laughing, but this was great. So thank you all so much. And I'm going to end here. Have a great weekend. It's Thursday, right? It has been one heck of a week in the United States. My head is spinning. All right, you guys, have a good one. Bye. Clarice, be in touch. Bye.